All right.
First of all,
Okay.
Good, thank you. Okay. According to the American Cancer Society, 3,090 new cancer diagnoses each year in North Dakota alone, and 1,437,180 across the nation each year. What cancer is, it mutates your cells and they begin to divide rapidly and spread throughout your body. A little background, personal background, my father actually had testicular cancer when he was 21, so I have a pretty good knowledge of cancer and experience with cancer on a personal level. Since cancer is such a common and widespread disease, it's important to educate about the causes, symptoms, and treatments to prevent or diagnose the disease. Some of the causes of cancer, like biological causes, cancer or malignant neoplasm is the technical term for cancer. It's when cells divide rapidly or and uncontrolled in your body. What happens is the cell mutates and fails to destroy itself because there is an actual, in the DNA of the cell, when you get cancer or it mutates, it's supposed to self-destruct. But what happens is it fails to do that and then it begins to mutate. And I have right here, you can see, here's some the normal cells actually, and each step as they begin to mutate and it spreads through the localized cells. And this is before it even metastasizes, which is when it spreads throughout the body. Now here I have another diagram. Here's a normal cell that just begins to mutate, begins to divide as it goes through, and then it begins to, you can see, it's become such a mess that it begins to break up, and then each of these cells can spread through the body. What it travels through is your bloodstream or your lymphatic system, and your lymphatic system is what fights, like, it travels where your white blood cells and all that can get through. It's like your filter, it's your body's filter, essentially. And what happens is you have lymph nodes throughout your body, and the cancerous cells get filtered through because your body's trying to get rid of them. But what happens is they travel to your lymph nodes and then end up making it worse. Some cells contain oncogenes, which are genes that promote cancer and which cause the mutation, and start to create traits for the mutations, like the rapid growth and mutation. Now, each cell has tumor suppressor genes. Like I said, that's the self-destruct. But what happens is these oncogenes turn it off in your body, and it prevents the cell, as I said, from self-destructing. Now, there are two different types of tumors. There's a malignant tumor, which is the tumor that allows it to spread through the body, and that's the most dangerous. That's what they worry about, and you need to get removed. Now there's a second type, which is a benign tumor, and all that is you have cancer cells that produce and grow, but what happens there is they don't spread, so you don't have to worry about getting cancer spread. The only problem is you want to get those removed because they begin to get larger and larger, and as they get larger, it can become like ugly, or it can cause a lot of discomfort and problems with the body. Now that I've talked about some of the biological causes, I'd like to talk about symptoms that you can get from cancer. The physical symptoms most commonly are large lumps, swelling, or hemorrhaging, which is bleeding, pain with the formation of a tumor, and often there are ulcers that will form from tumors. Some symptoms of, like, when it metastasizes, when it travels throughout the body, you get enlarged lymph nodes, as I mentioned before. You begin to cough up blood, and you could also discover new tumors throughout your body. And there's some other possible symptoms, such as loss of weight and appetite, extreme fatigue, and you'll have, from not eating obviously, severe night sweats, and loss of sleep. And these symptoms are all generic to just cancer in general, and not one specific type. So, I mean, there's a large number of other. If you get some odd symptom, you should get checked out. Now for some treatments and prevention options. When they diagnose you, you usually get a biopsy done, and they remove a portion of the tumor tissue or infected tissue or the mutated tissue, and then they test it, and that's when they can actually tell you what kind of cancer you have. Some of the treatment types, according to cancer.gov, surgery is used to remove infected tissue in cases where it's just localized and it hasn't spread greatly. But if it has spread, radiation is one of the most common types to use, which is used to localize on cancer cells in general and try and destroy them and shrink them. Chemotherapy is used to target cells using chemicals. Immunotherapy utilizes medicines and cause your body to fight the cancer. And there's no cure for cancer, and all treatments are usually used together to defeat the disease. So I'm sorry. Thanks.